To perform a manual peritoneal dialysis exchange, please start by going to the hub and printing performing continuous ambulatory peritoneal dialysis, CAPD, using the Ultrabag Baxter system. For this procedure, you will need 2 outlet port clamps, the ordered Dialysis solution, a mask for the patient, yourself, and everyone else in the room, sterile 2x2 gauze, Alkavis 50 solution, a disposable pad, a Baxter mini cap, spring scale, gloves, IV pole, and dry heat source. In terms of the dry heat source, you want to review the Addendum A attached to the procedure for the Enthermix IV now. It is important to know that the Dialysis solution will be heated in the outer wrapping. Should you no longer need the solution that was warmed, please disregard the solution that is no longer good to use. The solution will be heated to 37 degrees. This may take a half an hour or so you want to plan accordingly to warm fluids prior to treatment. You will now start the procedure by collecting your supplies, identify your patient, and explain the procedure. Place a PD in progress sign on the patient's door, shut the door, cover all air vents, and shut off any fans. Place a mask on yourself, the patient, and anyone else in the room. You will then wash your hands for 3 minutes with soap and water and don gloves. Remove the dialysate from the outer wrap and check for scale. The acronym we use to ensure we have correct fluids, since we do not scan the dialysate into the mark. SCALE stands for correct strength of dextrose, clarity of dialysate, amount in liters, check for leaks, and check for expiration date. Hang the dialysate from the IV pole. Place the disposable pad on the ground and then the drainage bag onto the disposable pad. Place an outlet port clamp on the fill line. You will then break the green frangible near the fill bag and then the blue frangible at the patient connector end. Saturate a sterile 2x2 gauze with Alkavis 50 solution. And clean the hard plastic end of the tubing. Be careful not to get the solution on the flexible part of the tubing, as this could break down the tubing. Clean for 1 minute, and then allow to air dry. Once dry, remove the pull ring from the patient connector end of the dialysate. Remove the cap from the patient's catheter and immediately connect. Open the twist clamp on the patient's catheter to begin the drain from the patient's peritoneal cavity. The drain will take approximately 20 minutes. You may remove your mask at this time. If your patient is not draining effectively, ensure all the clamps are open, there are no kinks. You can try repositioning the patient and ask the patient about constipation, as these are all reasons that could cause ineffective drainage. Once the drain is complete, close the twist clamp on the patient's catheter. Check the effluent for any fibrin. Fibrin will look like stringy egg whites. If any fibrin is present, you could add heparin at this point by following the addition of medication to peritoneal dialysis procedure located on the hub. We will now need to prime the tubing. Remove the clamp from the fill line and place on the drain line. Once the fluid has passed the patient connector end, this will happen quickly. Open the twist clamp on the patient's catheter and allow fluid to inflow into the peritoneal cavity. When the fill is complete, close the twist clamp on the transfer set and place a second outlet port clamp on the fill line. You will now replace your masks if they have been removed and rewash your hands with soap and water for 3 minutes. Don clean gloves. Open a mini cap package and ensure the sponge is wet with providine iodine and place it aside. Saturate a sterile 2x2 gauze with Alkalids 50 solution. And again, clean the hard plastic end of the catheter, being careful not to get the solution on the tubing. Clean for 1 minute and allow to air dry. Once dry, disconnect the Ultrabag tubing from the catheter and immediately place mini cap on the patient's catheter. You will now need to weigh the drain bag to obtain the output. Ensure that the spring scale is zeroed by moving the metal piece at the top till the arrow is at 0. Hang the drain bag from the spring scale. You will then drain the effluent into the toilet and discard. Document in the CAPD flow sheet the Dialysis solution used, any additives if applicable, the amount inflowed, the amount of fluid removed, and the effluent appearance. Please put in the inflowed amount and fluid removed numbers at the same time in order for the rows to calculate a net balance.